There's a great team.
Okay, so I think we can start. Well, today we have the pleasure of having Leonid Polishchuk presenting his paper on policy responses in the Russian regions. So, well, I think like we all are more or less familiar with him, so I will just give the floor to him. And yeah, that's. Thank you for accepting this invitation for today, Leonid.
Bernardo, thank you very much. And I would like to thank the colleagues for attending our presentation. Now, this paper grew out from a series of weekly meetings that we had in the spring of 2020. When we were all locked down, sheltered in place, unable to see each other, we decided to meet weekly to discuss our work in progress. And in the meantime, to think about new projects that could emerge from what was happening at that time in Russia and elsewhere in the world. COVID, of course, stimulated a great deal of research, and some very good papers are coming out, being inspired, motivated, and otherwise prompted by the pandemic. So during our meetings, we initiated several such projects ourselves, and I'm happy to present one of those, which is implemented by Igor Shagalov, Anton Shablinsky, and myself. I should caution, this is still work in progress. It's not a final say yet, and that's another reason why I would like to discuss it here and to solicit some comments and feedback as to how it can be improved. I hope you see the the presentation, and let's roll. So during COVID pandemic, governments were playing pivotal roles in mitigating, controlling, reverting the course of the pandemic. And COVID highlighted the role of governments in three key capacities. First, governments were administrators and enforcers of various pandemic restrictions, quarantines, lockdowns, suspension of travel, in conjunction with testing, contact tracing, and monitoring. Then secondly, were providers of emergency support to the private sector and to households that were serving as insurers of last resort. And third, governments were providers of emergency support to healthcare system of different sorts. And now, of course, these days, these functions expanded into development and procurement, administration, distribution of vaccines. So governments were key players in controlling the pandemics. Another interesting feature of COVID policy responses was that they were very heavily decentralized in pretty much every country in the world, to different extents, of course. COVID policymaking calls for a mix of national, federal, and subnational responses. And it could be useful to apply some very basic principles of economics of federalism in deciding what parts of COVID policies should be centralized and what should be decentralized. And there are standard rationales for centralization and decentralization, laid down basically by the famous Oates theorem. Rationales for centralization are spillovers of the pandemic and its effects across regional boundaries, spillovers almost literally. And then, of course, the need to mobilize and redeploy massive resources nationwide. What are rationales for decentralization? Of course, they're also pretty clear. Subnational governments can customize restrictions and support measures to local conditions. And in doing so, they would reflect variations in threat levels, demographics, geography, etc. And policy targeting and flexibility greatly enhance the effectiveness of pandemic containment, as pretty obvious. So as I said, countries around the world reflected these comparative advantages in the allocation of COVID responses between levels of government. I should also say that apart from these normative considerations, politics has always played a role, and political expediency, such as cost shifting, blame shifting, etc., was one of the factors. All right. So this chart shows how deeply uneven the pandemic rate was across pretty much every country of the world, save a few nations such as New Zealand and Korea. Pretty much everywhere else, we observe huge variations. For example, in COVID fatalities, across countries, and that includes not only big countries such as, for example, Canada, but also relatively small and compact countries such as Italy, well, Chile, of course, Bernardo is a big country, and see how huge was the variation in Chile, Mexico, Latin America. So obviously, the gravity of this problem was very uneven across a nation, and therefore decentralization was pretty warranted. And lo and behold, it was very heavily decentralized in Russia. So much so that people were talking about a rebirth of Russian federalism, because what we were observing in Russia over at least 2 decades was curtailment of federalism, centralization, building the vertical of power. And then, somewhat surprisingly, COVID response policies were decentralized much deeper in Russia than in some other countries. What the national government, the federal government, left for itself to manage was restrictions on international travel and some nationwide COVID containment measures. There were various mandatory vacation periods and some support programs, additional benefits for families with children, grace periods for various payments that were coming due during the pandemic, such as mortgages, salary increases for healthcare professionals, etc. However, otherwise, the enactment and administration of COVID policies was almost entirely left at the discretion of regional governments. And that greatly enhanced regional autonomy was a major departure from the centralization trend dominant heretofore over the last 2 decades in Russian intergovernmental relations. Well, there was a strong case for such decentralization because Russia was also very uneven spatially in the infection rate, as this map shows, huge variations. And sadly, in the mortality rate, also highly uneven. So these spatial variations of infection rate and mortality rate, as well as some other factors that are conventionally uneven across the huge country of ours, of course, called for profound decentralization of COVID responses. What motivated a great deal of empirical research after this pandemic, including us, is that, of course, COVID-19 has been and remains a huge natural experiment. The COVID-19 pandemic has created a natural experiment environment with COVID risks and vulnerabilities as treatments, and in our case, regional responses as effects. And I would like to mention at least 3 factors that make this natural experiment particularly informative and particularly tempting to use for empirical analysis. So the first one is deep and largely endogenous variation of treatments across Russian regions. That is the severity of the pandemic. The second one, of course, was the urgency and gravity of the problem. And the third one was the dramatically expanded regional discretion. Okay.
Sorry, so, one quick clarification question. So the first point, do you mean really endogenous and not exogenous variation?
Well, I wouldn't say they were entirely endogenous, but this is a natural disaster. And we tend to think that natural disasters occur more or less endogenously. I'm saying about the arrival of COVID, I'm saying the vulnerability, exposure of COVID. They were not very heavily dependent on policy responses. I'm not saying they're totally endogenous, but a great deal. Well, did I say endogenous?
Yeah,
Bernardo,
I think you mean
thanks
exogenous.
Very much. Exogenous, yes, obviously, you know. Okay, exogenous. Thanks very much, sir. That's really important correction. I will fix it. Exogenous, right? I'm still sometimes confused. What is endogenous? What is exogenous? But
yeah, I was a bit puzzled, so that's why.
Okay, right.
Clarify on the spot.
I go for record. It's exogenous, and please watch my presentation because there might be some other slips of tongue down the road. Okay, appreciate this. Okay, perfect. Now, what we wanted to do with this data, we would like to. I thought that would be a very good opportunity to explore, investigate, gauge the incentives and priorities of Russian regional governments that were responding to these exogenous shocks across the country. We thought that the evidence generated by COVID-19 shed light, among other things, on the incentives and on the agency relations in Russian regional administrations. Economists learn in the first year of their economic studies, the revealed preferences principle, which basically tells us that what you do tells us about what you like. Your choices reflect your preferences, priorities, so on and so forth. And we thought that the same would be true about Russian regional administrations. What they did, how much they did it, when they did it, so on and so forth, and tells us quite a bit about what their incentives and priorities are. And because of these exogenous variations were so, and even across the country, that would be a very good empirical case that allows a very nice identification strategy. Well, as we all know, in the Russian context, regional authorities balance their accountabilities and allegiances to two key principles in an agency relation. They are principal agent, right? So regional administrations are agents. But as far as principles are concerned, one possibility is that these are local populations, as I guess it should be, as expected to be. But the second one is the central government. And there is a big growing stream of research which explores this uneven loyalty, confused or ambiguous loyalty, I should say, between these two principles. Now, what we do next is we lay down some very basic welfare arguments that tell us as to how policy responses to COVID would be related to risks and threats, vulnerabilities, and other similar factors. So we would expect a certain association, empirically a certain correlation between risks, vulnerabilities, so on and so forth, and regional policy responses, based on the assumption that regional policy responses are driven by the concern about regional welfare. So if the local population are main principles of regional administration, so we should observe this association empirically, this correlation. Otherwise, if you do not observe this correlation, this association, the COVID data then would point to the preeminence of other types of accountability of regional governments, that their primary priorities and concerns are not about social welfare, but about something else. And sadly, this is something that we could suspect, if not expect, in the Russian vertical power system. Now, a very, very basic theory, it's not even a theory, it's back of the envelope calculations that explains what to expect if policy responses are driven by the concerns about protecting social welfare. Government policies at the time of pandemic must balance two key ingredients of social welfare, as we all know. The first one is public health, and the other one is state, the economy. One of policy tools during the pandemic are restrictive measures, such as lockdown, shelter-in-place, quarantines, and so on. These measures reduce infection transmission rate. Now, transmission rate in epidemiology is described by the so-called SIR model, which combines the shares of people which are susceptible, infected, and recovered. And according to this model, restrictions, of course, and without that model, it's also pretty clear, contain the spread of the disease. And as a result, restrictions reduce the welfare cost of the pandemic, public health costs of the pandemic, that's what I meant. And this is health costs, CH, which depend on two variables. The first one is the scale, the scope, the restrictions. And the second one is the risk factor. And we observe conventional behavior of this public health cost as a function of restrictions. But at the same time, restrictions cause massive collateral damage to the economy, and they produce entail economic losses. And these economic losses increase in the restriction and increase in the convex way. Now, how about risk factor? Risk factors increase public health costs and increase marginal public health cost. And that is, speaking technically, a super modularity condition that allows us to make immediate predictions about how optimal restriction levels should depend on the risk level. And it will tell us that greater risks call for ceteris paribus more stringent restrictions. Again, that's pretty clear, pretty obvious. And this chart shows that this is the marginal economic cost as a function of imposed restrictions. These are marginal public health benefits, and they're declining, of course, as the depth of the restriction goes up. But if risk level goes up, this marginal benefits cost goes up here, because of this supermodularity. And the intersection of these two curves moves rightwards. That means greater risks, greater restrictions. And again, this very simple argument is a basis for our hypothesis. Tells us that if restriction levels and their variations across the country that we are able to observe follow the risks level, then we should see some positive correlation between restrictions variously measured and risks also variously measured. Let's talk a little bit about support measures. Support is not our primary focus of interest for a variety of reasons. One is that the regional discretion in support measures was not as de facto broad as it was in restrictions, simply because in a very heavily centralized public finance system in Russia, regional governments did not have a lot of resources that they were able to allocate autonomously, independently from central government. So perhaps the variations in support measures would be somewhat less telling for us than the variation in restriction measures. Still, we would like to notice that government economic and social support measures in their turn should be commensurable to the imposed restrictions, mitigating their economic costs, and consequently also to risk factors. So basically, we should also observe some positive and empirical correlation of support measures to risk factors. Well, support measures could be to households, to the private sector, and also to the healthcare system. And support to the healthcare system should also be commensurable to risk factors, which affect the infection rate, and also to the pre-existing capacity of the healthcare system. The lower is the pre-existing capacity to handle the pandemic, the greater, the more massive government support to healthcare at the time of pandemic should be. And especially in the ability of the healthcare system to handle infectious and pulmonary diseases. Okay. To summarize, what do you expect from regional governments protecting social welfare? If regional governments are accountable to regional population, and if their policy selections are driven by concerns about social welfare, then restrictions should be positively correlated with risk factors and support measures with restrictions and risk factors. So what we do in the rest of the paper, we test these conjectures empirically using Russian regional data collected during COVID-19 pandemic. As soon as we decided to pursue this project, Igor got to work and collected a variety of data from a variety of sources about what regional governments were doing and still are doing in Russia. Now, another thing to further develop our hypothesis is that we expect that accountability of regional administrations should be uneven across Russia. In some regions, administrations are more accountable to local population than in some others. So in deciding their loyalty and alliance between the two principles, the national government and the population, they might strike different trade-offs between these two agency models. So what we want to do is to obtain some observations of the some independently obtained evidence of the extent to which regional governments are accountable to local population. Importantly, we would like to derive these indices independently from observing COVID policies. They might be related to the COVID pandemics, but they would be calculated not based on what regional governments are doing in containing the COVID pandemic. And we would use such accountability biases and deviations that we call governance anomalies as sorting factors. So basically, we have region A. For the sake of argument, we have Kirov Oblast, of which Igor is a native. And we try to independently assess to what extent we observe governance anomalies in the case of Kirov Oblast. And we conclude, we expect that if these anomalies are less pronounced, then the behavior of the regional administration in Kirov Oblast should be more in agreement with what our normative analysis predicts. And if such anomalies are more pronounced, then we should observe wider deviations of Kirov Oblast from what the normative analysis predicts. In other words, our measures of regional anomalies would serve as sorting factors in the relation between COVID responses and local risks and vulnerabilities. The greater is suspected bias, the weaker should be the association between risks and responses expected when regional policies are driven by regional welfare. And this is another conjecture that we could also test empirically, and this is the second objective of our project. So first, we observe, do we see across the sample of Russian regions the expected correlation association between risks and policy responses? And secondly, because we're a bit skeptical about that, we see, okay, if they're not correlated, what explains the deviations of actual policies from what the normative analysis predicts? And we would suggest that some regional anomaly measures would be involved in explaining this gap. All right. Now, let's talk a little bit about COVID responses in Russian regions. As in many other countries in the world, the instruments of choice in Russian regions in response to COVID were various restrictions to mitigate and slow the pandemic, including mandatory quarantines called isolation in Russia. Different names were used around the world. In North America, the popular expression was shelter in place, which means basically stay where you are. Mobility restrictions administered via various pass systems, closures of stores, services, public spaces, so on and so forth. As I explained, regional support measures were of lower magnitude given the still tangible presence of the federal government in this sphere and limited means and discretionary spending abilities of regional governments. And therefore, as I explained, restrictions imposed by regional authorities are our primary focus. And such measures, of course, exhibited significant variations across the country, which again bodes well for comparative analysis of regional policy responses. Here is another map, which shows how the duration of self-isolation requirements were differing from one region to another across Russia. And I hope you can see that the variations are indeed pretty profound. Okay, let's talk, it's time probably to talk about our data. We confined our observation period from March to September 2020, so we are not covering subsequent waves of the pandemic. Data have been collected from multiple sources, the Russian Public Health Ministry, Russian Statistical Agency, Rosstat, a Russian Consumer Safety Watchdog, which is responsible for the COVID management in Russia, which is Rospotrebnadzor, regional government data portals, which were used, and materials of regional COVID task forces. And then, of course, media reports and in the internet were also sources of information. Our sample includes 80 Russian regions, and we conventionally exclude the Moscow, St. Petersburg, and Moscow regions as two sui generis observations. They are likely outliers due to their status, size, special role in the Russian economy, intergovernmental relations, and so we are not including Russian capitals in our analysis. Let's talk about our key variables. Our dependent variables are restriction measures, and we in particular focus on three types of restriction measures. The first one is duration of self-isolation requirements, and they measure it in days. So we do two types of analysis, and will become clear a little bit later in the paper. The first one is cross-sectional analysis, where we observe a sample of Russian regions, and we take aggregate data for the duration of the first wave of COVID, and then we'll show some results of panel analysis. But what I'm talking now about is the first part is cross-sectional. So in this cross-sectional analysis, we calculate the duration of self-isolation. So that's one measure of how deep restrictions are. We also count the duration of the length of time for which government services centers, known in Russia as МФЦ, многофункциональные центры, were closed, number of days. And the third restriction measure that we observe is the introduction of passes. And this is a binary variable, yes or no. Support measures are economic expenditures from regional budgets, are social expenditures from regional budgets, and our regional public health expenditures. And these are three main support groups during a pandemic. households, firms, and healthcare providers. Okay, what are our risk factors? We concentrate our analysis on three. The first one is exposure, and we measure the exposure to COVID by the early arrival of COVID to a region. And that is, thanks Bernard, that's exogenous, right? And so the earlier was the arrival of COVID to a particular region, the more exposed this region in our analysis was. The second one is vulnerability of the region. That's another risk factor. So what makes a region vulnerable is share of the elderly and share of individuals with chronic medical conditions, which make them particularly susceptible to COVID. And the third risk factor is a lack of mitigating capacity. And we measure this, luckily this data is available, by the pre-existing number of beds for pulmonology patients per 10,000 populations. Okay, so how prepared was the regional healthcare system to meet with the pandemic? Now let's talk about regional anomalies. And remember, let me remind you why we need these regional anomalies. We would like to use these regional anomalies obtained or assessed, measured independently from COVID responses per se, as potential measures of biases in the allegiances of regional administrations to a local population. So what could be evidence of such anomalies or biases could be a lack of candor and transparency in regional reporting. So if suspicious about the quality of regional reporting, that would be an indication that the regional administration is less interested in presenting a clear picture of what is happening to the local population, which would be something that we expect from an accountable administration. What are examples of such reporting anomalies? And the motivation for this distorted reporting would be the desire to be seen in a better light by the higher-ups, okay? So examples of such reporting anomalies could be distorted reporting of COVID cases and mortality. And in the literature, two types of these anomalies were observed. The first one is the variation of daily reported cases of COVID. If you look at COVID statistics anywhere, you observe a jigsaw, ups and downs, ups and downs. And yet in some other regions, daily or weekly reporting is very remarkably flat. And that was a clear indication that something is probably not right in that case. Another, so the variation of daily reported cases is one measure of anomaly. The second measure is a ratio of reported COVID death to the actual mortality increase over the same period of time. So regional administrations report relatively small numbers of people who passed away from COVID. And then at the end of the year, Rostat tells us the number of people who passed away. We observe a huge jump. So what we do, we take the ratio of the officially reported COVID cases to the actual increase in mortality. And this is our measure of anomaly. And the lower is the number, the more pronounced the anomaly is. That's something to be kept in mind. And the same is true, by the way, about the variation. The lower is the variation, the more pronounced the anomaly is. And then, of course, we did not miss the opportunity to also take the voting for the constitutional amendments, which in some regions were abnormally high. So if you observe an abnormally high percentage of yes votes in the 2020 plebiscite on constitutional amendments, that would be another measure that we would use. We take some other anomaly measures that might be reflecting exclusive arrangements between a region and the national government. If national regions are particularly sensitive in their relations with the federal government, that might be because they've been able to strike particular exclusive deals with the national government. And we measure this by the share of ad hoc federal transfers in the regional budget. Russian regions are entitled to some transfers from the federal budget. Some transfers are received on ad hoc basis. So we take the percentage of this ad hoc basis transfers, and that's another measure for another anomaly measure. And finally, we didn't miss an opportunity to test a newly derived corruption measure that Timur Nathov, myself, and our good Belgian colleagues, Koen Schurs and Tom Ekehout, recently produced based on the observation on Russian license plates. And that's a separate exciting story, which we are wrapping up and hopefully we will be able to present it at this seminar later on. I don't want to spend too much time on this, not to steal the opportunity for us to talk about another hopefully interesting project, but we have some evidence-based corruption measure in Russian region, so we tested that measure as well. And at least in some instances, it played as expected. These charts show that our anomaly measures were quite unevenly distributed across the country. And again, that bodes well for our empirical analysis. They are correlated with each other, and they are correlated with each other in a predicted manner. So almost all of the correlations they're not huge, but almost all of them have the expected signs. And as you can see, they're highly statistically significant. So they show us different facets of anomalies in regional government. Okay. In the analysis, we use a battery of controls. We control for various factors of potential significance for regional restrictions and support measures, and those include population density, concentration, median per capita income, per capita public expenditures, some regional indices of democracy and corruption, independent from ours, so on and so forth. So we try various controls, and they usually do not change the findings. Okay, now about the results, and I still have hopefully a little bit of time for that. First, our baseline regression models. First, we test the conjecture that regional policies are correlated with risk factors in a manner which is predicted by normative analysis. And to that end, we estimate the following regression models in various specifications. In baseline restriction models A, we regress restrictions on risk factors and regional controls, and we include anomalies to controls. Okay, and we do the same for support measures, in which case we explain support measures by risk factors and controls instead of risks to avoid double count, because restrictions have been already affected by risk. We take residuals for restrictions obtained from model A, include them in model B. And if indeed, by and large, Russian regional governments were driven by their concerns about social welfare in response to COVID, both in terms of restriction and support, now we should observe that this coefficient of interest, beta 1, should be positive and significant, and the same in the second model. Well, guess what? The sad result is they're totally insignificant. And instead of showing regressions, which is a challenge to show because always struggle with showing big tables in presentations, just scatter plots. Okay, so horizontally, I measure one of the risk measures, which is COVID early arrival to a region, and vertically the length of self-isolation, and it's totally flat. We should have expected something like this. We don't see that. Now, this is increase in social expenditures, and this is a vulnerability to COVID, number of pulmonology patients. And again, these pictures are drawn more or less randomly from a large number of estimations we produced. And again, it's pretty flat. And if anything, it's insignificant. In these regressions, we can play with those because we can use various restriction measures, and we can use various risk factors and various support measures. So it's a variety and array of estimations, and all of them produce pretty much the same result. So this is just an illustration. Having observed that, we want to testing the second hypothesis that is an attempt to explain the biases in the regional policy choices from what is normatively expected. And we expect, as I explained, that anomaly measures that we derived, and I explained how they are derived, should play a role in explaining these biases. So what we do for restriction models, we estimate the model in which we include an interaction term between a risk measure and anomaly measure. And we expect that this interaction would have the predicted sign, so that the greater anomaly will make the response of restriction to risk further away to what we expect normatively, and weaker, lower anomaly will make this response more aligned with what our normative analysis predicts. And the same for support measures, okay? So, and again, we have a variety of specifications. We can play with various restriction measures, various support measures, various risk measures, and various anomaly indices. So estimations mushroom. And it's important to keep some, control over what is happening. So what we do, we estimated a large number of such regressions. And in about half of specifications with interactions, the letter R statistically significant and have the predicted sign in that anomaly indices indeed serve as sorting factors, which weaken the reaction of regional policies to risks expected when regional administrations are accounted to local population. And basically, the second half, the interactions are statistically insignificant, but almost all the time they still have the predicted sign. So the evidence is not ironclad throughout all specifications, but it's pretty clear and fairly consistent. So let me show you some of the results. I hope you can make some sense from this table. See, let's have a look at this regression, duration of self-isolation. And our variable of interest is early arrival of COVID, which is one of the risk factors. And we see that the coefficient is insignificant, okay? Nothing. And there is a bunch of controls, which I do not show here because of lack of space. But now I include interactions. And what I do here, or what we do here, I should say, we interact early arrival, which is a risk factor, with amendment votes, which is one of the indices of anomaly. And we see that this interaction is significant and have the expected sign. Another interaction, pulmonology beds and ad hoc transfers. Pulmonology beds are a risk factor, as I explained, if there are lack of those. And ad hoc transfers.
There is a question in the chat by Yelena. She's asking, how do you measure early arrival?
Okay, I need to explain that. Maybe Igor can do it better. There is a little bit of confusion in terminology, but basically we count the number of days in our observation period since the first case of COVID diagnosed in the region, okay? So the greater is the length of time that COVID was there officially, the more exposed the region is, and this is one of the risk factors, okay? To some regions, COVID arrived very early, and for them, this early arrival index is greater. To some regions, COVID arrived later, and then for them, this risk factor is lower, because we take it as evidence that the region is less exposed to COVID because of lesser travel, because of geography, because of everything. Okay? Did I answer that?
Yeah, thank you.
Okay, thanks. No problem. Thanks, Lena, for clarifying this. This is important. So here, another interaction, another risk factor, pulmonology beds, and another anomaly measure, ad hoc transfers. Again, significant and predicted sign. Duration of service closures, another restriction measure. Again, no interaction, no significance. Interactions come, they have predicted signs, they are significant. Passes, introduction of passes, this is a binary variable, and this is I believe it's a logit regression. Then Igor would correct me.
Yes,
I'm wrong.
Right.
Okay, thanks. So again, well, actually, in this case, we do have some significance of the early arrival of COVID, but again, interaction is significant and has the predicted sign. It's probably difficult to read this table, but instead, let me show you marginal effects, which are particularly telling. And unlike the small numbers are easy to present. What we do here is average marginal effect of pulmonology beds. The greater is the number of beds, the less risky the situation is. The sorting factor is non-transparent transfers. And we calculate the marginal effect of this risk factor on the restriction measure, which is the duration of self-isolation. And as we see, as expected, when an anomaly is less present, when the region is not that heavily reliant on non-transparent federal transfers, then the marginal effect of greater capacity of the region to handle the pandemic has the expected negative and significant effect on the duration of restrictions of self-isolation. But as soon as the share of non-transparent transfers rises, we see this effect disappearing. Another illustration is votes for amendments. And in our case, we calculate the marginal effect of curves early arrival, which is a measure of exposure, which is a risk measure. And again, our policy variable of interest is the duration of self-isolation. What we observe is that if an anomaly is less pronounced, the marginal effect is positive, as expected, and significant. But as this anomaly grows, the marginal effect dissipates. Excess mortality index is our measure of anomaly, underreporting of COVID mortality cases, basically. And we observe the same outcome that when this anomaly is less pronounced, and mind you, it's less pronounced here, high excess mortality index, mean that COVID reporting death is relatively honest. In this case, the marginal effect of what it is of COVID's early arrival is positive for the duration of government services closure. Same here. Here, the confidence interval curve is slightly unconventional, but this is because this is a logit estimation. Okay, but this marginal effects pretty much show the picture. Some more illustrations wouldn't be wasting your time because it's running out. Bernardo, can I have another like 5 minutes?
Yes, please.
Okay, we're close to to wrapping up. But again, we consistently observe, as I said before, the expected role of anomaly indices as sorting factors. And what we also did was we take the full sample of Russian regions, and these samples we test the hypothesis that policy responses are positively correlated in a predicted manner, positively or negatively, depending on our measures, with the risk factors, and we observed no such correlation as explained. However, when we reduce our sample to lower subsample of regions where anomalies are less present, we immediately observe the expected positive correlations, which become statistically significant. And here we reduce the sample based on votes for constitutional amendments. And here we reduce our subsample by the honesty of reporting of COVID death. So in other words, we take regions where the variation of day-to-day, week-to-week, day-to-day, I guess it was, reporting of COVID death was greater than elsewhere, great as it should be, okay? Same, right? See, flat for the full sample, and then the immediately transpiring association that we would expect from accountable governance if we reduce the sample to subsample of regions where independently derived anomalies are less present. In the remaining 2 or 3 minutes, I would like to quickly report the results of our panel analysis. In the cross-sectional analysis, we were relating policy responses to risks. In the panel analysis, we want to see to what extent day-to-day or rather week-to-week policy response measures in Russian regions were following the pandemic trends, okay? Because the threat level was uneven over time, and in this case, the threat level was directly observed by a number of COVID cases in the regions. And again, I should caution that we use the reports of weekly COVID cases, which were based ultimately on regional reporting. And as I explained before, those reports could be biased. That should be kept in mind. And that might be one of the reasons as to why overall panel estimations do not show the results that we would expect. So what we look for is evidence of 2 approaches. In the pandemic control, there are 2 approaches. One is to flatten the curve. That is to stop the spread of the pandemic, in which case restrictions are imposed in response to higher period-to-period case number increases. And that is, in fact, a clear recommendation of Rospotrebnadzor as to what regions should do. They should calculate the so-called RT coefficient, and that is That is the rate of spread of infection, how many people an infected person can infect. And that is measured by the number of new COVID cases calculated over a certain period, over the same number calculated over the previous period. Rospotrebnadzor recommends 4 days period. We have weekly data, so it's not, hopefully not a hugely big deal. So this is an evidence of flattening the curve approach. And another one is bend the curve approach. In this case, we should also follow the decisions to impose restrictions and to lift restrictions in response to higher or lower period-to-period case numbers variations. Okay, so here are two regression models that we panel regressions, of course, in that case that we estimate. And the first one is flattening the curve model. Our dependent variable is a dummy, which is equal 1 if a certain restriction, and again, that can be done for various restrictions, is imposed in region I in week T and 0 otherwise. CIT is the number of newly diagnosed COVID cases in region I in week T per whatever 10,000 population. And now important, this is panel, so we include full set of regional fixed effects and time week fixed effects and see what happens. In the case of bending the curve estimation, our variable of interest is not a dummy anymore. It takes a value 1 if a restriction is just newly introduced in this week in a region. It takes value -1 if a restriction has just been lifted in the region. And it takes value 0 if the situation remains as the previous week, no changes in policies. And again, controls, this time instead of ratio, we take difference. Ratios give more or less the same results. So what we do, we estimate both models for the full sample of regions to see if coefficients of interest beta-1 would be positive and significant, as we would expect if regional administrations were indeed following in their day-to-day policy decisions the pandemic's trends. And if not, and this is something that unfortunately we have to suspect, then if we would observe these positive and significant coefficients for a subsample of regions with less pronounced regional anomalies. And the results are as expected. For most of anomaly measures, the coefficient of interest beta-1 for the subsamples of less anomalous regions have much higher magnitude and or significant than for full sample. And that indicates that lower anomalous regions much closer follow in their restriction policies the evolving infection rates. So here are some of the results. We're talking about self-isolation, and we are estimating flattening curve regression models. We see that the full sample case increase is significant, substantially significant, and non-negligible. But if you reduce our sample to subsamples, based on variations of COVID reported cases, we take regions where variations was greater, which is evidence that these regions were more honest in reporting their more accurate, I should say, then see the coefficient jumps like more than 10 times and significance goes up. And the same is true if we take mortality index. If regions report higher actual mortality, then again, the jump is even greater and the significance is up. And finally, if you take regions which are less reliant on ad hoc federal transfers, again, this coefficient goes up by almost 10%, same significance level. Bending curve estimation, same results. For bending curve, for the full sample, the difference in case numbers is insignificant, sadly. But if you take subsamples of less anomalous regions, then it becomes significant and has the expected sign, and it's greater in magnitude. Well, that's it. Let me conclude by saying the analysis of policy responses to COVID-19 in Russian regions show that the association between regional policies and variations of risk factors across space and also in the panel analysis across time, which should be expected if regional decisions aim to protect social welfare, is weak at best and absent at worst. And this misalignment undermines the efficacy of decentralization of pandemic control and mitigation, which is quite sad, because you decentralize policy responses to regions for clear normative reasons. But if regional incentives are not what you expect in a well-functioning federal state, then this opportunity is not fully utilized. Now, we ascribe this observed discrepancy to the distortions in the incentives of regional administrations which operate under ambivalent agency relations. We measure such distortions by independently obtained indices of regional anomalies and show that such indices serve as sorting factors in explaining deviations of regional policy responses from the normative benchmarks. And we finally show on the positive side that for regions where anomalies are less pronounced, COVID policies are much more aligned with normative prediction. They're basically what they should be. And that's it. Thanks for listening.
Well, thank you very much, Leonid, for this very interesting presentation. So now the floor is open for questions. So please, if you have questions, you can either raise your hand or just speak up. Okay. Yes, please, Maria, go on.
Yeah, I just have like one, probably more clarification questions and substantive one. You consider their arrival time as kind of exogenous, but in some sense it might be endogenous in a way that usually COVID comes first to more like rich regions in the way that they have for better connection with either Moscow or some European cities, because it was like actually brought by transport. And if you have some distant region with slow infrastructure, COVID comes there later. So there might be kind of correlation between some welfare measures and arrival time. Thanks.
Maria, I totally agree. You're quite right. And this is why I'm not insisting that this is a totally exogenous factor. There is a degree of endogeneity, and this is what I mean this time. But what we do to mitigate this concern are two things. First, we control, as you can see here, for various factors of potential significance, and these controls include per capita income, median income. We also control for the administrative status of the region, if it's an autonomous republic or whatnot. We could probably include some geography controls. I'm not sure if we do it, but it's certainly possible. In our panel regressions, we control for regional fixed effects, if you remember. So that takes care of all of these regional specifics. So that somewhat alleviates this concern, although it does not eliminate it. And secondly, we use multiple risk factors. No, this is not the only one that we use. As explained, we use several of them, which characterize pandemic risks from various angles. And for all of these risk factors, we have a consistent picture. But you're certainly right; it's not entirely exogenous.
Hi, Leonid. Just a question, maybe is a clarification.
All right.
So, if I understood correctly, what you capture with all this very nice data set is that if you observe something, you can assume that there is something not working properly in that regional administration in terms of incentive, agency relationship, and so on and so forth. But how could you disentangle this from the competence at that regional level? Because we can see also in other settings that sometimes it is not really the wrong or the decision which the administration is really, or the administration in our setting is not really corrupted, but it is simply that they do not have enough competence in doing the right decision. Similarly here, could it be that they didn't do the right decision because they have not enough competence or skill or whatever? I'm asking this because in Italy as well, we had a lot of different regional differences in approaching the pandemic period. But it was sometimes really for different, let's say, skills at in the room of the decision.
Okay, well, thanks, Paul. This of course a very good point. I would like to make probably several clarifications, qualifying comments. The first one, of course, well, you know, in there is a well-known format for analysis of performance of public officials, going, for example, to Tirol or to Hewitt or whoever, and these people that wrote about incentives in government, and outcomes depend on effort, talent, competence, you call it, and unfortunately, in cases such as this, also on some random factors. So you do well if you're hardworking, if you're talented, and if you're lucky. All right. And of course, if we observe some disappointing outcomes, it could be ascribed to either of these factors or combination. That's certainly true. Secondly, we are not laying blame, we are not pointing fingers. Who we are to assess the performance of Russian regional administration. There are some special people for that. And what we do, we conduct statistical analysis, all right? And we observe deviations from what we would observe statistically for the whole sample if regional administrations were following the interests of regional regional populations. And thirdly, and in fact, we were able to identify some regions which did, as far as our analysis suggests, more in accordance to expectations, and these regions are in top deciles of the distribution of regions based on regional anomalies. So there is a handful of regions which we can name, if you like, which score well on these anomaly measures. But incompetence, if incompetence is to be blamed, is not entirely exogenous. It is also somewhat endogenous to the accountability of regional administrations, because a fully functional agency system is about adverse selection, about moral hazard. So you tend to concentrate on moral hazard, but adverse selection also a part of that. So if we observe, you know, fully functional agency relation, then we have more reasons to expect that not just honest and hardworking, but also more capable people will be at helm in regional administration. So these are basically two sides of the same coin, I would say, although this is certainly a valid concern. Sometimes, and again, in fairness, there was a great deal of learning by doing during COVID because no one was prepared. Pretty much all over the world, people made lots of mistakes. So sometimes there were genuine mistakes. But again, there was quick learning on the one hand, and then there were still statistically pronounced differences in performance outcomes. So learning and a lack of knowledge and expertise could be a sole explanation of what we observed.
Thank you very much. Thank you.
You're welcome. Thank you.
Please, anyone else has questions?
Sergey.
Yeah, just Paula, there was a guy called Pavel Milyukov before the Russian Revolution, and he was challenging something, and he was like, and somebody else, I think, asked him, so is that stupidity or is that treason? So like, we are not sure, right?
Yeah, no, we're not.
You probably are going to frown on that.
And again, I want to go for record to say that I'm not suspecting either.
Yeah.
I present statistical analysis and
right.
conclusions have to be drawn.
That's my concern that I wanted to raise second, that right now I'm not sure you have a meaningful message. You see what I mean? Like what did I learn today, right?
They being who?
Well, I. Like
you?
Sergey.
All right.
How
Okay,
much
so
did I learn today?
You refer to yourself
I'm not
as
sure, like if I go to Facebook and I'm gonna write a paragraph about this paper, I'm not sure what am I saying, right? So I think this is useful because it makes clear how to, I don't know, how to sell it, how to like, it makes it easier to sell if you know the message. And right now I see the message that, well, I mean, regions are different and some differences are correlated. So I guess I understand why you don't want to make it a specific, you know, claim about what it is, right? But there's got to be something. Like I'm I find it hard to suggest anything because I'm not sure, like, what are you going towards? You see what I mean?
Not entirely, quite honest, Sergey. And you know, I'm sorry, I cannot write a Facebook post for you. It's your job to find out. And if you find nothing to write about, then my best advice would be not to write anything, and just leave it alone. More seriously, the message, I spent almost an hour of your time trying to explain this, and apparently your question suggests that I was entirely successful in that. But just again, to repeat, the message is that COVID-19 has been a very informative natural experiment that sheds light on the nature of incentives in the Russian government system. And it allows us to test the hypothesis that regional policy responses were properly related to the variation across the country of factors that these responses should be affected. And we observe no such correlation. And that means that the basis for our assumption that is that regional governments, by and large, in their totality, are allegiant to local population is not confirmed. Well, that's a message. Well, I'm not saying it's an entirely novel message, but this is something which is evidence-based. Furthermore, we show that the discrepancy between what regions did and did not, and what we expect them to do, can be not just stated by this very set scatter plots. And again, every point, every deviation from this line is costly. It costs money, it costs health, it costs lives. Let me explain why. One moment, please. Here we go. This is where your intersection point should be. If you do not observe, excuse me, if you do not observe this correlation, then it should be either here, then it is either here or here. And every time you deviate from this optimal choice of policy, you suffer losses of different types. This area is what you miss in social welfare if your restrictions are too mild. This area is what you miss in social welfare if your restrictions are too stringent. So this is a costly deviation. And we show that these deviations can also be explained. We do not just observe them, we explain them, or rather relate them to some independently derived anomaly measures. So we show that we can measure the extent of deviation of what regional administrations do from what they expected to do if they're fully accountable to local population. And we show that these anomaly measures do explain the observed deviations from normative predictions. So that's the message, but it's worth a Facebook post of yours or not. It's not my call to decide.
Okay, final small thing. Anomalies, can I treat them as governance?
These are governance anomalies. Yes, you can treat them as anomalies, but as governance anomalies. So it's not a noun; it's an adjective.
So, like, ethnic differences would not be a part of that. That would be pure.
Say it again, please.
Ethnic differences would
not ethnic
be,
differences.
Yeah.
Well, what role ethnicity plays here? I don't see. No, okay. God forbid. No.
All right. All right. Thank you.
I'm an ethnically biased person. Sure. All right.
Any further questions?
Can I?
Yes, please.
I also have some questions. One is, let's start with the smaller one. Why you decided to base on early COVID counts, but not on growth rate of COVID cases?
Oh yeah, well that's this is a good point.
And actually, my question, this question rises that in news, how I follow them the last year, they usually claim that they take into account this growth rate, not just pure cases.
Okay.
So I think it will be nice to check.
Okay.
This is the first point, and the second point is that it seems you are thinking about the government of the region in a really cool way, that they could solve the problem of welfare maximization and base the decision on these issues. But don't you think that they could have another model in their mind? And for example, it is mimic model. So you don't need to think in your own what you should do. But especially in the situation when Moscow, St. Petersburg, and Moscow sub-region were the first to face COVID. So you are going to pick up one of these regions and just replicate their strategy. Or to be more sophisticated, try to do something on average, based on the behavior of these three regions.
Okay, well, Elena, both excellent points. Thank you for making those. The first one, outcomes. Our grand plan was to do two things. First, to see how risks and vulnerabilities affect restrictions, how risks, vulnerabilities, and restrictions driven by those affect support, second stage. And we did some of that. The third one was to see how all of that affected outcomes of the pandemic. What are the end results, such as mortality overall, such as infection, number of infected people, and economic losses. So we're trying and hoping to control. And so the third part is still outstanding. We might try to get back to it at some later time. It requires some more thinking about what would be a proper identification strategy in that case, but I entirely agree with you that it would be quite interesting to see if this, so far what we were able to do was to observe considerable deviations in what regions did from normative benchmarks. But what are the outcomes? What are, I pulled up this chart and I show on this picture that mistakes, selection of wrong policies could entail considerable losses of different sorts, either more sick people or greater economic losses that would be entirely unnecessary because restrictions are not justifiable by the level of threat, so on and so forth. But it would be very nice, of course, to measure it. And we hope still to be able to do it, but we haven't done it yet. So thanks for reminding us about this outstanding issue. Second, what you said, certainly, and learning from each other in subnational governance is a very well-known phenomenon, which I myself studied at some early time. And one of the advantages of federalism is that different regional administrations experiment with different policy ideas. So this is a huge testing ground. And governors or whoever look around and see what works and what not. And if there are some success stories, if there are proven successes, they will copy these successes, they will replicate these successes. So this exchange of ideas across the nation is a very powerful governance resource in a federal state. So there is nothing wrong about adopting policy that have been tested in Moscow and shown to be good, to be working well. And Moscow, you know, Moscow, of course, was the pioneer on many counts in COVID restriction measures. And so that does not undermine the message, because if you're a good governor, it doesn't necessarily have that you have to produce your own decisions. It simply means that you have to strive to implement the right decisions, and that requires a great deal of learning, checking, mimicking, imitating, whatnot. So I don't see this as a sign that something is not entirely right with this story. And of course, it's an entirely different story if you simply passively replicate what was attempted elsewhere without thinking as to whether that approach by your neighbor is suitable for your region. So in that case, it would be a wrong type of learning. But that again would be evidence that you're not sufficiently motivated to do what is right for your region. So it's a good indication, by the way, for our future work that Anton, Igor, and I could think about is to see for some evidence of this learning between regions. Thanks for suggesting this, because that's also a good case for testing this as well.
Just short comment on your words, because I'm not sure, I'm not claiming here, but whether we could say that these tendency to replicate some others' behavior could be highly correlated to your anomaly estimations.
I don't know, and this is why I said this is a great idea to follow. That's something that I would like to very much test, and as soon as the seminar is over, Igor and I will discuss what we. So it's a great idea. There was a considerable literature as to how these local decisions were spreading across the nation, and China is a good testing site. In the Chinese case, and people who wrote about Chinese federalism highlighted that local officials were fiercely competing with each other for investments, for job creation, for economic growth. That affected their promotion in a tournament-based governance system in China. And there were some well-documented cases as to, in one locality, a local administrator experiments with some approach, it works, and lo and behold, there is an immediate spread of this good idea. And in the early 2000s, produced a paper where I was trying to find evidence of such kind of learning in Russia, in Russian regional administrations. And we did find that evidence, although it was not entirely of the type that we hoped to see, because Russian regions, at that time, it was late 1990s, when the federal system was not very well aligned. They were learning bad things from each other. For example, they were learning from each other how to impose trade barriers, or how to issue junk bonds, or do other things, which were not really promoting economic welfare and growth. But this learning is of course a very important part of governance in in a federal state, and we will try to see to what extent the scoping was kept in place. I see, Maria, that's taken care of, right? Or no further questions, as far as I understand. No further questions, Your Honor.
Mm-hmm.
Okay.
Anyone else questions? Okay, we'll ask at least once, and answer is related to the graph that you are sharing right now, like the trade-off between restrictions and like the economy.
Mm-hmm.
So, and I mean, personally, I think that I would be interested in seeing more results with the panel, because I think that one important feature of this pandemic has been the dynamics, in the sense that it was the case for many countries that at some point they were like praised for handling the pandemic in a good way, and then at some point everything got screwed. And well, my point related to this graph is, I think that also the timing of the restrictions is very important. And for example, one good example is the United Kingdom, that like they were quite late in imposing the lockdown. Then they imposed like quite strict restrictions, but since they did it quite late, they are among the countries in Europe with like highest death toll, and also with the highest impact in GDP. So I think that the timing of the restrictions is also important.
Well, Bernard, I guess you're right. And to some extent, we take this into account. Come on, here.
Yes,
by, in the panel analysis by time fixed effects across the country.
I mean,
but how soon, you make a good point, I believe, and that is how timely a restriction was introduced in a particular region, because we somewhat reflected that, because one of our measures of restriction variable is the duration of lockdown. So a longer lockdown means earlier lockdown. You understand that, right? We take that measure into account. but but there is, of course, something to think about. I have nothing further to say, and you're entirely right, of course.
Okay, thanks. Any final questions? Okay, I think we have no
Okay, Bernardo,
Thank
now I
you.
resume my chair duty. I'm back. Thanks for substituting for me. And we still have one more session, right? Or the seminar?
Yes. So,
and that is.
Well, first, thank you very much for presenting.
It's my pleasure. Thanks very much to everyone for stimulating and thought-provoking questions.
Yes, and so for next week, we have the final seminar of this academic year, and we have Francesco De Caloris from Bocconi, and he's going to present his paper, Rules, Discretion, and Corruption in Procurement, Evidence from Italian Government Contracting. So that's going to be next Thursday, same place, same time. So, well, have a good evening, have a good week. Please take care, everyone, especially those in Moscow. That situation, it's getting more difficult. Yeah, see you everyone online next week.
Thanks very much, and bye-bye.
Bye-bye.
Ciao.
Very much. Bye-bye.
Thank you. Bye. Bye-bye. Thank you, Leonid.
Bye.